I'm Angela Gilbreath. I am attending Midwestern State University. My capstone project is the correlation between an elevated hemoglobin A1C and postoperative complications. The objectives of the PowerPoint is to understand the purpose of a baseline hemoglobin A1C preoperatively, understand the importance of a preoperative class for those who suffer from diabetes to modify their behaviors, reduce the risk of postoperative complications. Know your A1C before your operation can reduce the risk of complications. Anything less than 7 is in a perfect range to reduce complications after surgery. Diabetes presents a higher risk of delayed wound healing, increased risk of infection, and difficulty regulating blood glucose after surgery. Diabetes is one of the leading health concerns in the United States today. According to the Center for Disease Control and the National Diabetes Statistics Report, it is estimated that 34.1 million adults are affected with diabetes, some of which are undiagnosed or unaware that they have the disease. Hyperglycemia can be evaluated by using a hemoglobin A1C laboratory level, which gives a 120-day average blood glucose level. Chronic high blood glucose levels are measured by hemoglobin A1C, which indicates hemoglobin glycation average levels over 120 days. The normal value for a hemoglobin A1C is 5.7 to 6.4, and any value 6.5 and above represents diabetes and prediabetes. According to Jones, Graham, Morris, Richmond, Hollis, Wall, Copeland, Burns, Atani, and Hahn. The rationale and purpose of this capstone project is because diabetes is one of the leading health concerns in the United States today. According to the Center for Disease Control and the National Diabetes Statistic Report, it is estimated that 34.1 million adults are affected with diabetes, some of which are undiagnosed or unaware that they have the disease. According to Wong, Key, Ong, Lee, and Abdullah, diabetes predisposes patients for post-operative complications such as infection, sepsis, and delayed wound healing. According to Levi and Doherty, increasing evidence shows hyperglycemia in the perioperative phase is a modifiable risk. There are numerous interventions that must be introduced before surgery to improve surgical outcomes. Modifiable risks include lifestyle, nutrition, and glucose monitoring. Delayed wound healing is a detrimental surgical complication among those with diabetes. According to Wernick and Nahurek, tissue hypoxia, decreased blood perfusion, and prolonged inflammation can lead to tissue injury, interfering with the proper healing process. According to U.S. pharmacists, the cause behind infection among diabetics is an immunocompromised condition because uncontrolled blood glucose levels impair the body's immunity overall. Hemoglobin A1C prior to surgery will evaluate effectiveness of lifestyle changes, pinpoint changes in habits that are necessary, and serve as a predictor to post-operative complications. According to Teo, T. Seat, Paramasevan, Liu, Want, Chow, and Liu, diabetes and an elevated hemoglobin A1C level increases morbidity, mortality, and hospital readmissions within 30 days of surgery. Establishing a baseline hemoglobin A1C can give clinicians advance notice of possible complications if it is elevated. According to Dogra and Jalal, hyperglycemia in the perioperative diabetic patient may be an independent indicator of poor post-surgical outcomes. Once it is determined that a patient with diabetes has an elevated A1C level, modifications can be implemented to begin blood sugar regulations. Patient education will help those who suffer from diabetes to reduce their risk for repeated surgeries, hospital readmissions, and expensive complications. Ultimately, these improvements will be seen in the patient satisfaction and patient outcomes. The problem statement. In patients that suffer from diabetes, how does implementing an education class that includes modifiable lifestyle habits coupled with a baseline hemoglobin A1C level decrease the risk of postoperative complications compared to patients that do not engage in an education class and obtain a baseline hemoglobin A1C level? According to Sudkaran and Surani, those who with diabetes average more frequent hospitalizations, longer length of hospital stays, and acquire more cost to manage their care. The estimated cost of managing diabetics in the hospital setting can exceed $245 billion annually. A hemoglobin A1C is a diagnostic lab sample that is recommended to be below 7% to be acceptable for surgical candidates. The hemoglobin A1C plays a critical role in reducing postoperative complications. Patients with diabetes are more susceptible to debilitating post-surgical complications. Education, behavior modifications, and lowering hemoglobin A1C levels prior to scheduling surgery can improve the quality of health care for patients across the entire spectrum. The literature review was conducted by searching and reviewing scholarly articles and journals, reviewing data and analysis, and participating in an expert interview. The literature reviewed supports the correlation between an elevated hemoglobin A1C and postoperative complications. After reviewing the articles, the studies, and evidence determined that there is a correlation between an elevated A1C and postoperative complications. The literature determines that in order to reduce postoperative complications, those who suffer from diabetes must take ownership of modifiable behaviors to reduce mortality and morbidity. According to the American Diabetes Association, the determinant factors of diabetes, such as economic, environmental, and social aspects, which people are often surrounded by, are responsible for the beliefs and behaviors regarding disease prevention and treatment. The proposal plan description: modifiable behaviors such as diet, lifestyle changes, and blood glucose monitoring, including a baseline preoperative hemoglobin A1C, will lower complication risk during the post-surgical phase and encourage compliance. Patients that are educated in regards to lowering their risk of post-operative complications are more likely to engage in healthy behaviors. Healthy behaviors will impact long-term benefits and decrease the risk of post-operative complications, rehospitalizations, and costs. The risk of repeat surgeries for the patient, surgeon, and hospital will also likely decrease. The implementation will perform class during pre-admission phase, promote education about the importance of behavior changes that can lower the risk of post-operative complications, and will teach the patients the importance of nutrition and healing, how exercise promotes recovery, and how normal blood glucose levels can increase the risk of post-operative infection. During the pre-admission phase, a baseline hemoglobin A1C will be drawn and categorized as elevated or non-elevated using a t-test. Height, weight, and BMI will be evaluated and classified as normal or abnormal. HCAHPS scores, infection control data, and hospital admissions, length of stay will signify post-operative complications. All patients appearing for a pre-admission appointment will receive the education class and a baseline hemoglobin A1C over a 3-month period. Post-operative data for infection and readmission will be collected for 6 months. Evaluation. Standardized pre-admission appointments that teach an education class to include modifiable behaviors, a baseline hemoglobin A1C. The data to be collected is, did you attend the class, yes or no? Your height, weight, BMI, and A1C. Those patients that have modified behaviors and reduced their hemoglobin A1C levels within a normal range may proceed with scheduling their elective surgery. The outcomes expected would be an increase in healthy behaviors and modifiable risks, reduce elevated hemoglobin A1C levels, and reduced the length of hospital stay and reduced rates of infection. The dissemination. You can share the information collected in journal articles, webinars, professional forums, social media, national and state workshops, conferences, public events, and networking events. The summary: diabetes is rapidly becoming one of the leading health concerns in the United States. Understanding how to reduce the associated risk with diabetes in the preoperative phase can have a positive impact on postoperative complications. Everyone needs to be educated: the nurses, the surgeons, and most importantly, the patients. Healthcare members can work together to educate patients with diabetes regarding how to lower their A1C, adjust modifiable behaviors, and receive the best surgical experience possible while reducing their risk of complications. Thank you.